your nurse practitioner. What's your name?
Ralph Smith.
Ralph Smith. Nice to meet you, Ralph. Alright, well, I'm going to do a head-to-toe exam on you. Is that okay?
That is fine.
Alright, fine. So I'm going to be explaining all the procedures. I'm going to start with your head. So I'm looking at your head. I'm looking at the texture, the hair distribution, the symmetry of your head. And looks good. No areas of patches or anything. I'm going to move on to your face. You're looking at your face. Your skin characteristics, your eyes are symmetry, ears are symmetrical. I'm going to palpate your sinuses. Do you have any pain?
No.
No pain? Alright. I'm going to test your trigeminal nerve, which is your feeling on your face. You just close your eyes and just tell me if where you feel the pressure, okay? Close your eyes.
Just say left cheek, forehead, right cheek, chin.
Perfect. Alright, now I'm going to test your facial nerves. Just go ahead and raise up your eyebrows and close your eyes really tight together. Really tight together. And then open and close your jaw. And close. And clench your teeth. You can open up your eyes. And then show me your teeth. Stick out your tongue. Perfect. Okay. And have you ever had any problems with your speech or anything?
No, I haven't.
No? Okay. Alright, I'm going to go down to your eyes. So first what I'm going to do is I'm going to take this Snellen chart. It's going to be 10 feet away from you. I'm just going to have you close one eye. Close one eye, read as far down as you can. And then close the other eye, read as far down as you can. And then both eyes, and then I'll report that. Okay, for the sake of the video, I'm not going to go through all that just for time. So that tests your optic nerve, cranial nerve 2. And then I'm going to test your ocular alignment. So can you just look straight at the light? Okay, and I'm looking for the light reflex. It's slightly medial and in the center of his pupil. And that's a crude way of seeing ocular alignment. I'm also gonna test your vision as far as your peripheral vision. So look right at my nose and tell me when I move my fingers.
Yeah, I guess right finger or left.
Yeah.
Mm-hmm.
Just tell me if you see it.
Mm-hmm. Finger movement. Finger movement. Finger movement. Finger movement. Finger movement.
Okay. All right. Now I'm gonna test your pupil reflex. So look straight at me. I'm gonna dim the lights a little bit. Okay. So just look straight ahead. So I'm looking at his pupils. They're 4 millimeters, equal, round, symmetrical, reactive to light, brisk reaction, and also they are consensual. And I'm gonna have you just look behind my shoulder, just pick out a point on the wall, and then look at my pen, and then look at that mark. So look at my pen, and look at the mark. And they are they do accommodate to near and far-sighted. Now I'm going to test your six cardinal areas of vision, and that's your 3rd, 4th, and 6th cranial nerve. So go ahead and just look at my finger. And just follow it just with your eyes. Okay. All right. So now I'm going to do a fundoscopic exam. You just look straight ahead. And I'm going to get a little close to you, okay? So just try not to move your head, okay? So first I'm looking for the red dot reflex. And once I got it, I'm going to move in. I'm going to look at his optic disc. Optic disc is sharp. It's yellow, orangish. The cup to disc ratio is less than half. There's no splinter hemorrhages or cognal bodies that I notice on the right eye. Now I'm going to do the left eye. Just keep on looking forward, same thing. I got the light reflex, the red dot reflex, moving in, and the same. Now I didn't see any cataracts or glaucoma noted in that eye exam. Now I'm gonna just test your again your ocular alignment. Just pick a point on the wall behind me and just keep looking at that. Okay, I'm gonna cover one eye, and then your other eye, and your eyes are aligned. And I'm also going to do just your confrontation test. So cover any eye you want, just one eye. Okay, and just tell me when I'm moving my fingers. Okay. Okay, and now cover your other eye. Perfect. Okay. Now I'm gonna move on to your ears. Okay. So first, looking at your ears, they're symmetrical. Feeling the auricular, your tragus. No masses or marks or anything like that. No discharge from the ears. I'm gonna look inside your ears. Okay. So your tympanic membrane is pearly gray. Light reflex is at 5 o'clock on the right ear. And the ear canal is patent. I don't see any earwax or anything. There's some earwax in this one. Again, pearly gray tympanic membrane, no signs of erythema or swelling or ear infection. Now I'm going to test your hearing, okay? So this is the Weber test. I'm just going to use this. You just tell me which ears you can hear it out of, okay?
Guess my left.
You heard out both?
Yeah, I took it.
Okay. All right. Now I'm gonna start with your right ear. Okay. You just tell me when you can't hear it anymore. Okay. Just tell me when you can't hear it anymore.
About now.
Okay. Tell me again when you can't hear it.
Okay, let's see. Grandma wash your hair?
No.
Okay. Perfect. And I would repeat that for the other ear too. And that's the Rhine test. And also I'm gonna do the whisper. You just tell me what I'm saying. Just keep on looking forward and just tell me what I'm saying.
3,
9.
9. 9.
Okay. Again.
3, 9. Key.
Okay, and that's the whisper test. And your hearing looks good. I'm going to go onto your nose. So looking at your nose, just go ahead and cover one and just sniff in. How do you problems with clogs? And then the other one. Okay. And then to test your olfactory nose sense, I would use like some kind of aroma, and I would test your smell that way. Okay. And then that would be, I'd actually test it by 4 different measurements in the office. So again, I'm going to go in, I'm going to look at your nose, okay? Look at your tuber-nits. It's a patent, clear, moist. Again, patent, moist, no signs of erythema or drainage. Now I'm going to look into your mouth. Just go ahead and, again, open and close your mouth. Okay. All right, no clicks or anything noted on the jaw. Go ahead and stick out your tongue. Now I'm looking at the tongue, looking at the teeth, making sure there's no missing teeth or erythema or swelling. Go ahead and stick out your tongue all the way and say ah.
Ah.
Okay. I'm looking at the back of the throat. The tonsils are not enlarged. There's no erythema, swelling. Go ahead and swallow for me. Do you have any problems with swallowing or anything?
Yay.
Okay, so that tests cranial nerve 9, 10, and 12.
That's for your body.
And now, do you have any problems with speech or anything? Can you say 3 words, LT and 9?
LT and 9?
LT 9, yeah. And so his
Nine.
speech is normal. Now I'm going to
Yep, there you go. Down your arms.
test your neck and your shoulders. So I'm going to go straight down. So this is, go ahead and shrug your shoulders. Okay, so about a 2+ on his shoulders. And can you move it to the side of your neck? And then extend your neck and flex it.
You smell good.
Flex it all the way. Any problems there?
Nope.
Okay, just go ahead and can you rotate your head and just push against my hand? Okay. And the other side? Push really down. Perfect. So about 2+ on your strength of your head and neck, which is really good. I'm gonna feel around for your lymph nodes now, okay? So these are your preauricular nodes, and just tell me if there's any pain. Postauricular,
No pain.
occipital, tonsillar, submandibular, sublingual, superficial cervical, posterior cervical, deep cervical, and supraclavicular. I don't think anything. Can I get your shirt to come off, sir? I'm gonna go down to the back exam, or I'm gonna come right behind you, and I'm just gonna feel your throat. Okay. So actually, can you stand up for me? I'm just gonna feel right behind your throat. Okay. And the trachea is midline. I'm feeling for his thyroid. Go ahead and give me a swallow. Okay. So I don't feel any masses or swelling or anything like that. Looking, you can go ahead and have a seat now. Looking at his neck, I don't see any JVD. There's no lesions or masses that I note. I'm gonna go around to his back. Can you go ahead and stand up? So I'm gonna look at his back. Look at any retractions, masses, scars, anything like that. Just go ahead and give me a deep breath in and out. Okay. So looking for a chest excursion. It's about 3 to 5 centimeters. Now I'm just gonna kind of palpate on the spine. Palpate down the spine. Feeling for any step-offs. Do you have any pain or anything like that?
No pain.
Okay, I'm gonna test for CBA tenderness. You just tell me if you have any pain. No?
No pain there.
Okay. No CBA tenderness noted. Now I'm gonna kind of percuss your back. Okay. You just just breathe normal. And those are all tympanic sounding, which is hollow. I didn't feel any dull sounds, any areas of consolidation. Can you go ahead and say 99 for me?
99.
Keep on going.
99.
Okay.
99.
Perfect. So that was tactile frematus. I didn't feel any areas of consolidation. And now I'm gonna listen to your lungs, okay? So you just go ahead and breathe in and out. Just nice deep breaths.
Wow.
Okay. And all your lungs are clear bilaterally. If I would have heard any crackles or areas of consolidation, I would have done the E test and say E, and then it would sound more like an A if there's areas of consolidation. Okay, so now I'm going to go back to the front. You can go ahead and have a seat. So again, I'm going to finish with the respiratory exam. I'm going to look at his chest though, look for any retractions or anything like that, intercostal retractions. I'm also looking for any lifts, heaves in his chest, and also make sure it's symmetrical bilaterally. Okay, so I'm going to finish up with the respiratory exam. You just go ahead and breathe normal. Deep breath. last one. Okay, lung sounds are clear on the front as well. Now I'm just going to palpate your chest, okay? And palpate all your precordial areas. So this is aortic, pulmonic, second pulmonic, tricuspid, and mitral. Now this is your mitral area. This is also your point of maximum impulse, and it's not displaced in any way, so I don't feel any displacement. I'm also gonna, I forgot your carotids on your neck, so I'm gonna go back and just listen to your neck for any bruits. Okay, I don't hear any bruits or anything. Now I'm gonna go ahead and listen to the rest of your chest, all your areas when you're sitting down, laying, and standing. Okay, or laying down and then on the left side position. So just breathe normal. And then I'm gonna listen to it with the diaphragm. Second pulmonic, aortic, and those are that all sounds good. No murmurs. I don't hear any extra heart sounds. A normal S1 and S2. Now I'm gonna have you lay down all the way. Lay down flat. Okay, same thing. Aortic, pulmonic, second pulmonic, tricuspid, and mitral. And again with the bell, aortic, mitral, tricuspid, second pulmonic, aortic. Now if you can go ahead and lay on your left side and scooch a little bit more closer to the bed, at the end of the bed. Okay, perfect. Same thing. I'm listening again with the bell and the diaphragm. Okay, aortic, pulmonic, second pulmonic, tricuspid. Move your hand a little bit. Second tricuspid, and move this in, and mitral. And I would listen again with the diaphragm. Okay, you can keep on laying flat like that. Now I'm going to move on to your abdomen, okay? So I'm going to be touching and pushing. You just tell me if you have any pain. So I'm looking at his abdomen. It's symmetrical. I don't see any scars noted. He doesn't know masses or areas of distension. So I'm going to go ahead and listen first. So listening in all 4 quadrants. And I'm just listening to your bowel sounds. If I didn't hear any, I would listen for a full 5 minutes in each quadrant to actually declare them absent. But they are normal active bowel sounds. And now I'm just going to listen to your arteries, okay? So I'm just listening for your aortic. And just listen for any bruit, any signs of like aneurysms, and your renal arteries. And your iliac arteries. Your iliac arteries. Down here. And I don't hear any bruise. I'm just going to listen to your femoral too since I'm here. And I don't hear any bruise in your femoral arteries. Okay? Now I'm just going to push around your abdomen. Okay, just tell me if you have any pain, okay? So I'm going to just palpate all 4 quadrants. And I'm going to feel your lower costal angles. And I'm feeling for basically any masses. Feeling for your spleen. I shouldn't be able to feel it in this left upper quadrant. If I did, you might have a little bit of an enlarged spleen, but that's okay. Everything feels normal. And then this is McBurney's point. This is about where your appendix is. It's a third of the distance from the iliac spine to the umbilicus. So, and if you had some tenderness right there, I might be thinking of appendicitis. Another test I'm going to do is just a Murphy sign. Just exhale, and then take a deep breath in. Okay. Okay, and if you had some pain right there, that could be cholecystitis. Another test for appendix is this Rossing sign, where I press in on your left lower quadrant, and if you had pain in your right lower quadrant, it could be appendicitis. Another sign for appendicitis is your psoas sign. So all you have to do is just flex your leg. So just go ahead and push up against my hand. Okay, and if you had pain in your right lower quadrant, that could be a sign of appendicitis. Another thing I'm going to do is just percuss for your liver, okay? So I'm going to start superior and work my way down, and I'm going to listen for a dull sound. Okay, so it's right there. I'm going to start my way up. Okay, so his liver marks are about between 6 and 10 centimeters. So between 6 and 12 is normal. I'm also going to percuss the rest of your stomach. And those are all tympanic sounding. If there's any dull sounds, there could be some areas of large amounts of stool or mass. But they all sound tympanic. So I'm gonna go ahead and I'm gonna actually keep you laying flat. I'm gonna move my way down to the lower extremities. So I'm looking at your both your legs, making sure they're symmetrical, palpating the patella. Any pain when I'm touching?
No pain.
All right, I'm gonna go ahead and remove your socks. Is that okay? Okay. So again, I'm looking at his legs. I already felt his femoral pulses. There are 2+. I'm also gonna feel his dorsalis pedis and his posterior tibial, and those are all 2. Feel nice and strong. I'm gonna test a reflex down here. It might tickle. Okay, so this is Babinski reflexes are both intact and they're normal. Capillary refill is less than 2 seconds. Okay, and I'll go ahead and can you do me a favor? Just rub this heel up and down this shin, up and down. Perfect. And the other one now. Okay, perfect. Now I'm gonna also go ahead and flex your knees and extend your hips. Push your hips off the bed. Perfect. Okay. Alright, so that's pretty good strength. You can go ahead and push my hands right now and pull back towards your nose and lift up this foot up off the bed and this one off the bed. Okay. So he's 2+ for strength on his lower extremities. His pulses are good. I'm going to just do a couple. These are a couple tests if he was having knee pain. Do you have any pain in your knee?
Very little.
Okay, well I'm going to go ahead and test. This is a drawer test. I'm going to just put your knee up. This test is both ACL and PCL. Okay, so I would actually sit on your foot and then pull traction against your knee, and then I would push, and I'm just looking for any instability or displacement of the tibial plateau. Another test I could do is the varus and valgus maneuver, and that's just gripping is testing the medial collateral ligament and the lateral collateral ligament, and I'm just feeling for any instability. So I'm just going back and forth, and then again I would hold this arm, hold that, and then push against his femur. And there's no instability. I would do it on the other side too if I was suspecting maybe a instability on his ligaments, but they all feel good. Again, I'm gonna do some range of motion exercises. Okay, so can you flex your knee all the way. All the way, yep, all the way to chest. Oh, perfect. Okay, and then we're gonna extend, and then the other leg, flex and extend. Any pain?
Okay.
Okay. Now we're gonna just do some dorsiflexion, which is up, and plantar flexion, which is down. Any pain? Dorsiflexion, plantar flexion, and no pain with internal or external rotation where I'm moving.
No, feels fine.
Okay. Okay. And go ahead and sit up. We're gonna go up to your upper extremities. You can put your legs over across the bed. Perfect. Alright, again, I'm going to look at the skin characteristics, make sure your arms are symmetrical, hair distribution, any scars or anything. Do you have any pain in your upper extremities?
No.
Okay, so I'm just feeling for your pulses. They're both 2 plus bilaterally. Your capillary refill is less than 2. Go ahead and squeeze against my hands. Perfect. Your grip strength is 2. I'm gonna do a couple of neurological tests. Just do me a favor and just go up and down with your hands really fast. Perfect. All right. And another one is just touch my finger and then touch your nose. Keep on going. Wait. Yep. Keep on going. Finger, no, just one hand. Yep. Yep. And then over here. Yeah. And then the other hand. Just touch. Keep on going. I'm gonna move my finger. Keep on touching in your nose. Perfect. Okay. All right. So no problems with coordination there. And I'm also gonna go ahead. This is a rebound test, so just go ahead and make a fist, then push against my hands. Okay. Other one. Perfect. And push down. Okay. And also your strength is 2 plus on your upper extremities. Grips are great. I'm just gonna do some range of motion exercises. So go ahead and we're gonna do first adduction. So just go with your hands up and down is abduction all the way across your just go ahead and bring your arm all the way across, yeah, and your other arm all the way across. Okay, now just go ahead, we're going to do some flexion and extension, and we can do extension on your back. Can you go backwards? And the other one. Perfect. Okay, and then we can do flex on the shoulders. Just go straight forward. Okay, perfect. And then this is a supination. Hold your hands out like this and flip them over like that. Supination, pronation of the wrist, so it looks good. All right, and then internal rotation of your arm and external rotation. That looks good. Perfect. Now I'm going to just test. This is another neurological test. I'm going to put something in your hand. You just close your eyes and just tell me what it is, okay? What is that?
Feels like a pen.
All right, perfect. And other arm?
Feels like the same pen.
Perfect. And that's diagnosis. I would test with multiple objects, paper clips and stuff like that in the office, but for the sake of the video, I'm trying to limit the time. This is a graphesthesia. Close your eyes. And we're gonna, I'm gonna draw something on your hand. You just tell me what it is, okay?
More like a figure 8.
Figure 8, perfect.
Also figure 8.
Perfect. Okay. All right. So diagnosis and graphesthesia is intact. I'm just gonna review, make sure I didn't miss anything. I'm pretty sure I'm gonna do your DTRs now. Okay. So these are your deep tendon reflexes. This is your tricep. Just go ahead and let me control your arm. Just relax it. Okay. Brachial. Just go ahead and relax your arm. Okay. And your radial brachial. Okay. Those are all 2. Again, your other arm. Just go ahead and relax your shoulder. Just lean it against my hand. Okay. Tricep. Brachial. And radial. Okay. And now I'm going to just do your patellar, just nice and relaxed. Okay. Just relax. There you go. Nope, just relax. Okay, that's 2 plus, and I'm also gonna test. You go ahead and lay on your stomach again. I'm just gonna test your Achilles DTR.
Stomach?
Yep, on your stomach. Great. I'm just gonna test your Achilles. Okay. And again. Relax. Okay. So those are all 2 plus. You can go ahead and sit up now. So your DTRs all look good. We're gonna stand up and do what's called a Romberg test. You're gonna just stand up, close your eyes, and I'm looking for any instability in his gait. I'm gonna give him a little push. He looks nice and steady. Now can you do a heel to toe walk? All you're doing is just, you can open up your eyes now. This is gonna be good. Alright, and your gait looks good? Perfect. Alright. And go ahead and bend down and touch your toes. And I'm looking at his back, just looking at the curvature. You have any pain?
No.
Okay. Go ahead and sit back up. And then go ahead and extend your back. Any pain?
No.
Okay. Perfect. Again, I'm gonna look at my test to make sure that we got everything. You got heel to it. And I think that's everything. Okay, Mr. Conway.
Alright,
All right. Thank you.
thank you.
Have a good day.